because your stomach is small. This thing is obvious. You have a small stomach and you have to put food and water inside. That is not going to work, else you're going to be short of one. Lovely people, welcome to the Black Bariatric Hero community. My name is Oluwafelumi and I am your host on this channel. Welcome to the part 2 of this video. I hope you enjoyed the first part. I hope it's informative enough and I hope that you find value from it. To all my returning subscribers, thank you so much for stopping by. I really appreciate you. Thank you for subscribing to my channel and being a part of the community. To everyone seeing my face for the first time, thank you for stopping by. You might consider subscribing to this channel and joining the community. So this is the Black Bariatric Hero community. On this channel we talk everything about weight loss, surgery, everything that has to do with weight loss, lifestyle, faith, and life in general post surgery for me. So it's a channel to record my progress and support other people going through weight loss surgery. So I hope you find this interesting enough to join the community. So today's video we will be talking about everything that you need to know about weight loss surgery. What are the risks involved in weight loss surgery? So of course, for every procedure there are risks involved. There are likelihood of complications and things going south. However, the bariatric surgery is considered safe. It's considered to have high success rates, about 92%. So if 100 people go for weight loss surgery, 92 of them will be successful at attaining their goal weight at the end of the day. So what are the risks involved in weight loss surgery? So the risk involved you can't exhaust the list really. There's a lot of risk involved. There could be bleeding, there could be infection, you could become malnourished because your body is not absorbing enough nutrients. You could become malnourished because you're not eating enough. So you need to be more intentional about the nutrients you're taking. You need to be big on your multivitamins and your medications as prescribed by your surgeon. Some of the risk also is gallstone. So gallstone, most of the hospitals will give you a medication that you would use to prevent gallstone. So you're going to be using this medication once every 3 months. So it's a full course. So the cost is for a month. So that's like 3 months in a year you need to be on this medication. So you use this medication to prevent yourself from developing gallstone after surgery. How do you develop gallstone after surgery? Because your stomach has been cut into size, or the anatomy of your stomach has been changed if you had a gastric bypass. So the emptying of your gallbladder is affected. So it's not emptying properly. Therefore, bile acid stays in the bladder for too long and it forms stones basically. So then you need to be careful with your gallbladder. Yeah, you need to be careful with your gallbladder. And also kidney stone, kidney infection, because you're probably going to be drinking less. Where do you want body water? You cannot take a cup of water and gulp down as usual. So you take little sips, and if you're taking little sips of water you get tired quickly, trust me. And yeah, so you need to be intentional about your water. Post surgery you'll be advised to have 1.5 liters to 2 liters of water daily. And how I got by with that is taking little sips. So I got myself this 2 liters water bottle. I fill it up daily and I just sip till I'm done with it. So yeah, so you need to be intentional about drinking water as well, because you are at high risk of developing kidney stones or kidney infection from not drinking enough water. So acid reflux is like a big thing when it comes to weight loss surgery, because for the gastric bypass it's a bit mild, but for the gastric sleeve it's a big thing. You cannot eat and lay down on your bed immediately because your stomach space is now very small. So the acid your stomach is producing for the normal big size stomach you have is still what it's still producing. However, now you have a small container to take it, so you have reflux is from there. So when you eat, you need to make sure that you're eating a long time before your bedtime, so you're able to digest the food before you go to bed, and drink enough water before going to bed as well to neutralize the acid in your stomach from refluxing. And a very common one is the dumpling syndrome. So the dumpling is very common because you're used to eating and drinking normally before you had surgery. So you have a higher chance of thinking that you can do the same thing after surgery. Sorry, you can't. We don't do that here. No, you eat, you rest between your food, and you drink water afterwards. Or you drink water and you wait a while before you eat. Yeah, you can't do both at the same time. Because where are you putting them? You need to arrange your food. You have a very small stomach. Imagine if you are traveling with a box that is small and you have so many things to put in it. What do? You arrange it. So that's what we do here. You arrange your food in your stomach, leave it to settle, then you put water. So that's what we do. Yeah, so really, you cannot eat and drink water at the same time. If you do that, you're going to have the dumpling syndrome. The dumpling syndrome is literally you throwing up after food. Okay, and before you throw up, you're literally going to feel like the food is building up to your throat. You know that feeling? You will feel like the food you're eating is not going down, it's staying somewhere here, and you can literally feel it as you swallow that the food is just lifting up here, and you're just going to throw up. So yeah, so that's dumpling syndrome, and it's very common. It's one of the side effects of weight loss surgery. I can't count how many experience of that I've had. You have to eat a bit, take your break, then drink water afterwards. This will not go on forever. So as you recover and as you get used to, I guess over time you get used to your new stomach and your new way of life. So it will become easier. Really, it's the initial phase that gets difficult. Now I'm used to it. I don't even bother eating and drinking water at the same time. I choose my battle. If I want to drink water, I drink water. If I want to eat, I eat. So yeah, it gets better over time. But for the first 4 to 5 months post surgery, you will definitely need to give your stomach space to settle food before you add water to it. Yeah, risk involved in weight loss surgery is low blood sugar. So because post surgery, you'll be encouraged to go on liquid diets for the first 1 month. Basically, that's the explanation for that. Because you're not eating so much, your blood sugar is going to be reduced. But that's the whole essence of losing weight, right? So your blood sugar goes down, the body produces less insulin, and you tend to lose weight more. So when your body, insulin is what makes you add up weight. When your body is not producing insulin, your body starts burning fat to survive, right? It starts burning fat for energy, to supply you energy to do your daily work. So your fat storage begins to deplete because your insulin level is down. You don't have sugar. So yeah, you tend to have low blood sugar. And in weight loss surgery, liquids are things that if you put your spoon in them, it comes out clean. That's liquid. Not something that you put your spoon in and it comes out stained. Okay, so even when you're having yogurt, you need to dilute the yogurt with water so it is running, or you dilute the yogurt with milk, skimmed milk, so it is running. So when you put your spoon in it, it comes out clean. So for the first 3 weeks, you will be drinking water, yogurt, diluted yogurt, please, not huge scoops of yogurt. Diluted yogurt, thin running yogurt, soups, but your soups are without spices, 0 spice soup. So if you are making soup, you only add salt and your seasoning to the soup. So you're not adding things like ginger, things that will irritate your stomach lining. You're not adding them to your soup. Nothing like ginger, garlic, all those herbs. No, you're not putting them in your soup. For me, I didn't have soup in my recovery stage because it was just going to taste bland. I didn't want to bother. And because you were not going to have appetite, you need to be very intentional about eating. Else, you go for weeks without remembering that you've not eaten, because you won't feel hungry. You will feel zero hunger. So that's the part that chills me the most about the surgery. For the first almost 2 months, I was feeling zero hunger. Like I wasn't hungry at all. And even till now, I feel hungry when I remember that I've not eaten. That's when I feel hungry. and you literally need to remember that you're not eating for you to know that you're supposed to eat. So you have to give yourself that period of recovery post surgery. Drink water, drink very light liquids. So you can have tea as well in your recovery. So you can't have tea because tea is running. No, you can't have tea. You can't, I mean, tea bag. You can't have hot chocolates or Milo or what do we make in Africa? Tea. No, you can't have that because they are filled with sugar. So you, in the recovery stage, you need to be very careful. That's the stage where people get their stale, where they don't lose any weight. So most likely you would have had a pre-surgery diet where you would have lost a couple of weight. I lost 5 kg in my pre-surgery diet. When I went through for my surgery, I was weighing 130.4 kg. I lost 5 kg, 5.2 kg before my surgery on my own. But then after surgery, people complain of not losing weight immediately. That's because you're confusing your stomach. You just had surgery and you're taking sugary drinks. So the sugar slides through, goes into your bloodstream, and acts like you've had food. Meanwhile, you're not supposed to be having food. So you get my point. So the period where you're fasting, your body have enough storage of fats to take you through that period. When you start eating again, you still have to eat healthy, high protein meals that will help you retain muscle mass and help you to maintain a low insulin level in your bloodstream. Common side effects is bowel obstruction. So because you have a small stomach, you're eating very small, your digestion will be, your bowel movement will be slow. So when your bowel movement is slow, you tend to retain your waste products for longer. You're not going to go to the toilet as frequently. If you have a toilet habit of going to the toilet every day, which is a good habit, sorry, you're not going to have that habit now, because you need to eat something to pass something, right? So if you're not eating so much, there's no much to be passing every day. You'll pass maybe once in in a week once in a week, or once in 4 or 5 days, really. So yeah, so you're going to have, then because you're not moving your bowel daily, you might develop bowel obstruction, which is one of the complications of weight loss surgery. So that's the wrap up for that one. The proper preparation for weight loss and the post-recovery stage of weight loss surgery. So preparing for your weight loss surgery, depending on the hospital that you go to, you're going to have a pre-operative diet. So the pre-operative diet basically is aimed at reducing your blood sugar so that you have a better chance of healing when you have your surgery. It also aims at reducing your liver size. So they call it liver shrink diet. So the liver shrink diet is you're taking zero sugar, no sugar at all. For the first 2 weeks of your surgery, you will most likely be asked to have zero sugar, high protein, low fat diet. So that's what you're going to be having, high protein, low fat diet. That's where your liver has less thing to work on and it shrinks. The reason why your liver needs to shrink is because weight loss surgery is not an open surgery. They don't open you up to have the surgery done. They use robots. So they only put little tiny holes in your tummy, put in a robot to do the work. So because it is not an open surgery they can physically see, they are seeing your stomach through a system, they really need to be careful. So they don't want to cost your liver and cause you more problem. So they ask you to go on this diet because the anatomy of the stomach, your liver is laying part on your stomach. You have a part of your liver laying on your stomach. So if your liver is not shrinked well enough, they might accidentally cut your liver. So you need to have this phase of your surgery. You cannot carry it over. You need to have this phase of your surgery. So the pre-operative diet is a 2 weeks diet with zero sugar, zero or very low fat, and high protein. So they will encourage you not to have carbohydrates sugary drinks and all the likes, but you can have chicken, eggs, cheese, and things like that, milk. So that's the pre-operative preparation phase. And after your pre-operative preparation state, when you go to your hospital to click in, you would most likely have examinations done. So your blood samples will be taken for tests. Then you have an endoscopy done. Endoscopy is done under anesthesia. This is when a camera is passed into your stomach to check what the stomach lining is like, what the situation of your stomach is. So they want to know if you have severe ulcers that would give them problems, or if you have hernia or anything like that. So that is what the endoscopy is for. It's a major part of your surgery. They need to do it. This has to happen before you go under the knife. So, and then after that, then you are taken in for the surgery. So if all your results are fine, they'll do a chest x-ray as well to see that your lungs is fine and your heart is fine and you're going to recover from surgery. So they do all these things. Most likely for my hospital, it was done just the morning before my surgery. You do all these tests, and then after that you are taken into theater for surgery. Surgery lasts, for the gastric sleeve, it lasts an hour. For gastric bypass, it lasts between an hour and a half and 2 hours. So you have your surgery done. If you are having gastric sleeve, within an hour you're out of surgery. And after that, surgery recovery phase starts. So you're definitely going to have a drain, to have 3 incisions for your surgery, between 3 and 4 incisions for your surgery. They're just tiny, very tiny little incisions. In fact, they are very small. I wonder how you have one big one where they will take out the stomach if you're having a gastric sleeve. But for the gastric bypass, I think it's the same size all through. For the gastric sleeve, they need to take out the 80% part of your stomach that is being cut off. So you have a big incision about 2 centimeters long where that one will come out from. But the other ones are very tiny little incisions, really. And then you have a drain. So the drain is to monitor any leak from your stomach, because they just suture it up. They need to know if it's leaking. So it's to monitor any leak. So usually before your surgery, you would have been on 48 hours fast. Nothing, no water, no food, because your stomach needs to be empty, completely empty. So pre-surgery, 2 days before your surgery, you are on 0 food, no food at all. So I had my surgery on Monday. I started fasting since Saturday, and I didn't eat until the following week, because after surgery you still don't eat for the first 1 week. You only have water. So yeah, so it was like a 2 straight weeks of fast, of 0 food. It's amazing. So yeah, so post-operatively, once you come out from theater, you have a drain to your side and you have 3 or 4 incisions in your tummy. It is very painful. Post-recovery is very painful. I was literally screaming down the hospital. It was so painful. But then you're going to be given an medication, pain relief, analgesics to recover from the pain. The pain will generally subside depending on the type of suturing you have. So some hospital would ask you to pay for robotic suturing. Some will do normal manual suturing for you. For the robotic suturing, is been said to be less painful, because they use different sizes of sutures and stitches for different parts of your stomach, depending on the thickness and the consistency of that part. But for the manual suturing, they just use one straight suture for everything. And then because for human you use force, for robots use the accurate force for each part, so it's the tension in your stomach is less for the robot. So the pain is different. But the recovery phase is painful. It is. Brace up, prepare yourself, it's going to happen. Yeah, so it's very painful, but then it's worth every bit of it, trust. So you get pain medications to manage your pain, and then the pain subsides. So the pain only lasts between immediately after your recovery to like the 2nd day. So of course you're not going to be in severe pain for a whole day. No, of course you're going to have pain medications, but then you will still feel the pain. When you get up on bed the next day, you're still going to feel the pain. And 6 hours after operation, you most likely be asked to walk, because you're going to have a lot of gas pain. So during the surgery, your stomach is inflated with gas so that it bloats up, and the robots are able to see what they are doing. So they are able to manipulate the robots inside you because they're only walking through a small incision, right? So they blow you up with hair. And when the surgery is done, this hair is trapped in your stomach and is really painful. That is where the pain comes from. You need to walk. So walking helps relieve the pain, helps relieve the gas pain. So 6 hours post surgery, you will most likely be asked to walk around. You walk around, you come back, you go around with your drink, and then 12 hours post surgery, most likely 12 hours or the next morning. In my hospital, it was 12 hours after. You'll be given a leak test. So they do a leak test for weight loss surgery to see if your stomach is leaking. So the leak test, I'm going to attach the video of mine here. So the leak test is a blue water that you drink, and they expect that if your stomach is leaking, they should see blue water in your drink. If it's not leaking, of course there won't be any blue water. So yeah, so you drink the blue water. The taste is very terrible taste, but then you drink the blue water and they just look out for it in your drink. If you pass leak test, then you are allowed to start taking water. You take the blue water in the morning. I had mine in the morning, first thing in the morning. You'll be asked to take it very little sips, 2 sips of the water, and then of the blue drink, and then they'll give you 6 hours to see if it drains, if it leaks. So if after 6 hours you don't leak, then you are allowed to start drinking water. And even the water, it's one tiny cup like this. It will take you the whole day to drink it immediately after surgery. So you start drinking the water slowly. The 3rd day, your drain will be taken out. So literally you'll be in the hospital for 3 days. Your surgery day, the next day after surgery, and the 3rd day when your surgery will be taken, your drain will be taken out. So the drain comes out the 3rd day, and your dressings also come off the 3rd day. And after the drain is taken out, then you are going to be given your post-operative recovery plan. So my hospital had a nutritionist attached to me and a surgeon attached to me. So I can speak with them anytime if I have any problems, if I have any concerns, I speak with them. And the plan, my post-operative plan, is to be on liquid diet for 1 month post-operative. Then after the 1 month post-operative, then I go on puree. So in the liquid phase, you can drink water, skimmed milk, anything that you can put your spoon in and it comes out clean. That's water. That's considered liquid. That's all you can have for the first 1 month. And after 1 month, you can start having puree like cheese, cream cheese, yogurt, kelp. I'll put pictures of these things to the side, so you can start having all of that. Then 2 months after, then you can start having food, which is you can only have a very little bit of food at a time. So basically that is what your post-operative phase look like. Then you need to have your medical checkup, 1 month post-op, 2 month post-op, 3 month post-op. So you need to go to your doctor to have your blood test done to see that your nutrient level are fine. You need to have tests to check if your iron level is good, if your potassium and everything, all your micronutrients level are fine. If they are not, you'll be prescribed multivitamins or medications to help you with any part that you are deficient with. But you definitely need to do the test because now you're eating very less. You need to make up for those things. Your body is used to having this volume of nutrients and everything. If you cannot just take it off suddenly. So you need to do your tests regularly post-operatively. So basically that is your post-recovery phase. You're going to have more videos regarding pre-operative, more detailed video regarding pre-operative phase and the post-operative phase and all that. This is just a summary video to tell you an overview of what your surgery would look like. And I hope you've enjoyed this video to this point. Please consider to like, share, comment under this video if you've gained value from it. And if you're considering having weight loss surgery, please stick around to this channel. You're definitely going to get value from here. You're going to get lots of information from here. And I hope this channel helps you to make your decision on whether or not to have your weight loss surgery. So I'll see you some other time, guys. Thank you for watching. Bye.